people, a missing tooth makes a statement. Alfred E. Newman has been the face of Mad Magazine for decades now. Look at that missing tooth there. All right, Stu the dentist stole the show in the movie The Hangover with his toothless antics. But in my case, toothless is not cute. Here to show us various ways to fill the void, please welcome back cosmetic and family dentist Dr. Terri. All right. Before we get to replacement, let's just start with, if you do knock a tooth out, a permanent tooth out, what should you do immediately?
Well, if you do knock a tooth out immediately, first of all, you want to put it in a glass of milk. You don't want to take anything that's going to disrupt the root or any of the nerve endings on the root, so you put it in a glass of warm milk and take it immediately to your dentist.
Because sometimes you can put it back in and it can take root again?
You absolutely can. You have 1 hour to do that in.
Wow.
Yes.
Okay.
And it can survive.
Okay. But when it doesn't survive, there are a number of options to either replace or camouflage the gap, if you will. The first one, I guess probably the most permanent one, implants.
Yes. Let me just say one thing. When you lose a tooth, either through trauma, through fracture, infection, whatever, it only takes 2 weeks for your teeth to start shifting.
So you should do something about it.
2 weeks, because if you don't, it will be a lot more costly in the future. So what happens is when a tooth is lost, your teeth on either side start to drift into the space. That's just how nature is. And if it's a bottom tooth that you've lost, the top tooth that opposes it will want to drift down to touch the tooth that's not there anymore, and it will cause a lot of problems. It can cause bite discrepancies, it can cause headaches, and even TMJ disorders.
And just cosmetically, you have crooked teeth.
Exactly. So we have choices now. And of course, the first choice is a dental implant. And I brought a little model here. So what an implant is, it's a titanium screw that actually fits into the jaw. And then you have to make sure that your general dentist is the gatekeeper that actually coordinates the treatment between the dentist and the specialist that puts the implant in. The implant actually is put into the jaw, and it takes about 3 months to heal. Now, in order to get an implant, number one, you have to make sure that you have adequate space for an implant. You have to make sure that there is adequate bone, healthy bone, and that the gums are healthy. So then after it heals, then your dentist goes in and he puts in, or she, I should say she, she puts in a titanium post, and then the dentist will fabricate a crown to put over the post.
Yeah, so that's probably the optimum.
This is actually the ideal solution because number one, it's very easy to clean. You're only affecting one tooth, and this is really where dentistry has gone to now. So this is the number one choice, would be a dental implant, but not everybody is a candidate.
Right, right. All right, so if you're not a candidate for that, a bridge.
Exactly, a 3-unit bridge. Now before implants were in play, bridges were our only option. So a 3-unit bridge is where you have 3 pieces, you have 2 porcelain crowns, and depending on where they are in the mouth now, they can actually be metal-free. So if they're in the front of the mouth, they can be metal-free. And then you have a tooth that's suspended, and they're joined together, so they're a little bit more difficult to clean. That's why an implant is so important, is, number one choice.
Whose mouth did you take that from?
The giant.
Yeah,
and then it's just placed on, and it's cemented or bonded on.
Okay, removable partials.
Okay, a removable partial, basically the problem with removable partials are they are the least costly of the 3, but the problem is you're relying on clasp that go over the teeth, and sometimes they're metal and they're not real sightly, and to hold it in.
Yeah.
So it's removable. The other 2, the implant and the bridges, are permanent. Now, we now have new types of partials that are a lot more aesthetic. They're called Valplast partials. And a Valplast partial is actually lighter in weight, and it has tooth-colored clasps that go over the teeth to keep it in place. So it's much more aesthetic looking.
Yeah. All right. Okay, and then moving on to the flipper.
The flipper. Everybody remembers in high school, well, at my age you would, where the kids had retainers and they'd take them out and put them on the tray, and then the cafeteria lady would take it away and you'd lose it, and your parents would get so upset.
Of course, today we watch Toddlers and Tiaras, where little girls go, I put a flipper on, now you can't tell.
So these are flippers. Basically, you can't eat or chew with them, but it replaces that one tooth, and it's a aesthetic alternative. Now remember, if you have a partial or a flipper, you can always transition into either a bridge or an implant.
Okay. And then there's the Snap It.
Yes.
Mini, it's kind of like a mini Snap-on Smile.
This is a mini Snap-on Smile. You guys have heard me talk about Snap-on Smile, which is a full arch appliance. It actually fits over your teeth to change the shape or the color. And this is a mini Snap-on. Basically, this patient has a missing tooth, and you just place it on.
And snap it right on over. And you can eat with that?
You can actually eat and chew with this. Now, this is not going to last forever. This is more of a temporary type of appliance. But yes, this is a little bit better than a flipper. If you're having an implant, you have to have a temporarily to replace, or if you're just missing a tooth and you can't afford your other options.
Yeah.
But it's better to do something than nothing, because it will be a lot more costly later because your teeth will shift.
You don't want braces later is a whole bit too. And the key is to get to the dentist as soon as possible. And obviously, if you can't get there within that first hour, to at least get there within, as soon as you can, really, because you don't want that shifting to take place. Dr. Alani has a special offer through October. All new patients get half off a new patient exam, x-rays, and regular dental cleaning.
Yay!
Call Dr. Alani at 713-621-5141, 713-621-5141, or find her on the web at TexasToothLady.com. Also, Dr. Alani co-hosts a radio show with her brother you saw earlier, orthopedic surgeon Dr. Wayne Alani. It's called For Your Health with Terri and Wayne. It's on every Saturday at 9 a.m. on CNN 650 AM.